Hey guys, welcome back to another video. My name is Shivan and I'm a second year medical student studying at King's College London. And in today's video, I'm going to talk to you about how you can make the most of clinical placement. So before we get into the video, I want you to go check out my YouTube channel. I make videos about medical school and university. So I have day in the life videos, vlogs, get into medical school videos, videos with medical school advice like this one. So go check them out. And if you enjoy my videos, do hit that subscribe button and join me for a lot more. Like I said, today we're going to be talking about clinical placement, a massive part of any medical student's life. Even if you're a nursing student or a dentistry student, placement is going to be part of what you do. So today, I'm going to give you some tips to make the most of this opportunity, and they're not just my tips. I've asked a few other medical students for tips that they would give people starting their placement or people who recently started placement or are going to start placement, anything. And I've accumulated some of the best advice that medical students around me have to give and that I have to give, and I'm gonna give it to you right now. So let's get right into it. First of all, I just want to say that placement is what you make of it. If you engage with placement more, you'll get more out of it. You have to be proactive, you have to grab every opportunity you can. So, my first tip would be to prepare for placement the day before you go in. So, use the day before to figure out where you're going the next day. Accordingly, sort of prepare for that particular ward or that particular clinic or wherever you're going to be placed or whatever activity you're going to be doing. Each specialty has their nuanced skills, like their specific histories, examinations, and be sure you have those sort of revised and prepared the day before so you can go and implement them and practice them the next day. That would be tip number one. So my second tip would be to have some goals in mind when you go into placement. Let me give you an example. Go in thinking, I want to take a history today and I want to present it to someone and I want to get this particular clinical skill signed off. Go in, try to get this done, try to achieve your targets. If you can't, that's okay. As long as you tried, you can know that today wasn't a wasted sort of day. I didn't waste any opportunities I had, because there were these things that I had to do, but I couldn't do them, but I did try to do them. You know what I mean? A lot of times when you go into placement, you sort of are clueless about what you're supposed to do, and if there's someone who's not really sort of guiding you that much, which can be the case, you are left just observing, which is also important sometimes, but it's nice to be able to actually do some things, actively participate. So if you have these goals in mind, if you have a plan in mind, that'll really help you with doing that. My third tip is to take a small notebook with you. Now that's because you'll need to take notes when you're taking a history, because you'll need to present this history back to your sort of whichever doctor you're under. And you won't be able to remember everything from the history unless you write it down, because it's a very long process. Also, you may hear something that is pretty important on the ward or in the clinic, and you'd want to write that down as well, and you'd want to have some place to record it before you forget. So that's why carrying a small notebook is very useful, and carry a small one like one of these, because I made the mistake of carrying this absolutely massive notebook with me initially when I started placement, and it was a pain because you can't slip this into your pocket or keep it anywhere, and it's like a big pain to carry this around a ward where there are lots of people. There are not that many surfaces to keep things, so yeah, definitely carry a small notebook, not something like this. So you want to carry a notebook, but at the same time you don't want to take too many notes, because if you take too many notes you won't be able to pay as much attention to what you're hearing. I think at times it's much more important to listen to what the doctor or nurse or whoever is saying and sort of respond with relevant questions to try and understand what they're saying and to sort of internalize it, rather than to just start jotting things down. because if you start jotting things down, you're wasting your sort of cognitive capability on writing, whereas you could be using it to pay attention to what someone else is actually saying. And then if you ask them questions, that'll help you retain the information as well, because you'll remember that question you asked and you'll gain a sort of better understanding of whatever you asked the question about. The next thing I would say is to wear comfortable shoes, because you're standing all the time in placement, especially if you're on a ward. If you're in a clinic, you most probably are sitting down, but if you're on a ward, you could be standing for a long time. One day I remember, I think I stood for 3 or 4 hours straight without sitting down, because there's no place to sit down over there. So you want to be comfortable. So that day I remember I was wearing these shoes and they're so uncomfortable, honestly. I mean, my feet were just dead, and all I could do was sort of think about how much my feet were hurting, and I couldn't pay attention to what was going on around me. Then I sort of bought these shoes that look very similar but are much more comfortable because they have a lot of padding in them. So you definitely want to get a pair of shoes like that, or you can wear trainers or all black trainers, because I think in most placements those are acceptable. Yeah, definitely get a comfortable pair of shoes so you can pay attention to actual clinical stuff rather than your feet. Also, have enough outfits for placement, because placement clothes are very high maintenance. You have to iron them, you have to constantly clean them. So doing that every time you go to placement is a big pain. So you want to have multiple sets of clothes that you can just wear one after the other, and then after maybe 4 or 5 days of placement, maybe longer, you just wash all of these clothes together and iron them all at once, and you get it out of the way, which is a much more efficient way of doing it, and you can do that if you have multiple sets. So don't underestimate the need you'll have for placement clothing. The next tip is to never forget your stethoscope, because you never know when you'll need it. You don't need it all the time. There are many days you might not even use your stethoscope at all, but it's better to have it with you and to not need it than to need it and not have it with you, because it can have a bad impression on whoever you're sort of placed with, and you don't want that to happen. And the stethoscope makes you look more professional. It makes you look like you're meant to be there. It'll instill a degree of confidence in you, and it'll increase the patient's sort of confidence in you, which is important for your learning. You don't want the patients to think you don't know what you're doing, because at the end of the day you look like a medical student, and the stethoscope reassures them that, like, yeah, you do know what you're doing. You know what I mean? Now imagine this. You go into placement, you're meant to be in a particular place. You show up there. They're too busy for you. They say you're not meant to be there. They don't have enough sort of staff to accommodate you. They don't know you're supposed to be there. I don't know. They have some issue. What are you gonna do? That's why you need to have safety places around the hospital. So when you're on your placement, notice different wards you go to or different clinics you go to, and think about whether this could be a good place to come back to learn something, to practice something, to get good experience. And if it is, keep it in mind. Maybe note it down somewhere. And if you're ever out of luck when you come to placement in terms of the place you're supposed to be, you can just go there, and that makes sure that you sort of capitalize on your placement days and you don't lose out at all. Because it would be a pity if, like, you know, you made it all the way to the hospital and you just realized that there was nothing for you to do. So always make sure that there is something for you to do in the hospital. And also make sure that it's okay that you're there. Make sure it's okay with everyone that you're there with, whoever's organizing your placements as well as whoever's in that particular clinic or ward and all that. Just be sure. My last tip would be to sort of get your sign-offs done as soon as possible. So if you're a medical student, you'll definitely have skills, histories, examination, things that you need to get signed off. So definitely get those done as soon as possible, and get the doctors to sign you off as soon as possible as well, because the longer you delay it, the higher the chances are that they'll forget who you were and what you did, and then you won't get your sign off, or you'll have to repeat what you did. So definitely do it in the first 1 or 2 days. I'd say if you could do it like right then, that would be the best thing. But definitely don't delay it too much, because after a week or two you'll be out of those doctors' minds or whoever's minds, whoever was supposed to sign you off. I think that's everything. That's all the tips, all the advice that I have for you. And if you're starting your clinical placements soon, I hope it goes well. Do let me know if any of these tips work for you, and if you have any tips for me in terms of things that work at placement, do let me know down in the comment section below. I still go on placement. I'd love to know like things that work for you guys, so I could potentially implement them as well. Other than that, I hope you found the video useful, and if you did, do drop a like down below. Hit that subscribe button so I can make better videos for you guys, and also share the video with any of your friends who just started going on clinical placement or are about to start going on clinical placement. And yeah, I'll see you in the next one.